Hello, I'm your host, Peter Komendowski, and welcome to Surviving Bad, where we explore Iowa stories of survival, hope, and inspiration. Today we explore an unintended consequence of life in a pandemic, an increase in child abuse that may be going unnoticed. As social connections are breaking down, adverse childhood experiences, referred to as ACEs, are on the rise, and with it a potentially alarming rise in child abuse. We're joined by Greg Belville of Prevent Child Abuse Iowa and Lisa Cushett of the Iowa ACEs 360 to shed some light on the problem and solutions. Let's meet our guests. Greg and Lisa, welcome to the show. Greg, tell us a little bit about Prevent Child Abuse Iowa.
Thank you for having me, Peter. Prevent Child Abuse Iowa, our mission is to empower community prevention efforts to provide safe and happy childhoods through collaboration with diverse partners, leading to a better future for Iowa. And really what we want to try to do is build that capacity throughout the state to support kids and families so that kids grow up and they feel happy and safe and secure, and that benefits all of our communities. We do that in a number of ways. We have programs and education efforts to help build that education, skill, and awareness throughout the state. And we also advocate at the state, local, and national level for policies and family-friendly things that really help to support and build those protective factors that help prevent that need for child abuse call to ever happen in the first place. So it's a work that our team is all very passionate about, and we work hard with other members of the community to help see that mission come through.
Now, I know you've been doing this work for a while, and your organization is, of course, very, very valuable and important in Iowa, but there's been some troubling signs that things are getting worse because of the pandemic. Is that the case?
That is what our fear is. Yeah, as we see these increased stressors of job insecurity, job loss, fear about illness in the household and at schools, and all of this uncertainty, the social movements that are going on right now, and the unrest that's happening there, on top of all of the other stressors that already existed for children and families, there's a fear that those increased stressors and as you said, the social isolation that's taking place is decreasing the amount of supports that families have and can lead to greater risk for abuse in the household.
Lisa, tell us about your organization, because I know that you're involved with a very, very important way of sort of measuring risk factors. Tell us a little bit about yourself and the ACEs 360.
Great, thanks. And again, thank you for having me. So Iowa ACEs 360 focuses on using research-informed strategies to prevent and mitigate the long-term impact of childhood trauma. We do that in a few ways, quite a bit of advocacy and systems change work. We do research and education-related work, and then also work with communities both in central Iowa and around the state around innovative ideas to better support families and communities. I think when we look at what is going on and those increased stressors that Greg was talking about, we really have to remember that this pandemic, and as we talk about it, we often will hear the phrase, well, this is a great equalizer. But in fact, yes, we're all being impacted by it, but not equally. And so in addition to the stressors in the home and that the financial worries and other things that Greg was talking about, we have to really look at holistically at what's overall going on in the community impacting that family. And so, as he said, when we see the challenges around financial stability, that social isolation, when we are seeing families experience racism, when we're seeing families experiencing lack of access to food, increased poverty, increased medical expenses, those are not equal across populations. And so in addition to any stress internal to the home, the amount of stress that's impacting families out surrounding the families is having a great impact on them as well. And so it's really important that we look at that whole picture, and some of the examples that Greg gave and that I just mentioned, that whole picture when we're looking at how do we support families right now.
Now, there are some traditional things that have been researched where we show that things like divorce and crime are peculiarly strong influencers or adverse childhood experiences. What are some of the top ones before the pandemic that were really of a
Yeah.
concern to us?
Yeah. So we actually just released the 2020 Iowa ACEs report. It is based off of data that's collected every year by the Iowa Department of Public Health on that childhood adversity. And it focuses on 10 types of trauma or ACEs that happen internal to the home, and it's adults reporting back on what happened to them in childhood. And so about 63% of Iowa adults will say they experienced at least one type of trauma. When we look at the rates of trauma and why, since our last report, we've actually started to include neglect. So areas such as neglect, denial of critical care tend to be higher than some other areas, but also issues like a parent struggling with substance use or mental illness. Those are other areas that, depending on who is surveyed a particular year, can be higher.
These are great points. We're going to take a short break. When we come back, I'd like to continue to take a look at the sort of checklist of risk that children face, because maybe not all parents are aware of how this affects a child. We'll see you all after the break. You don't want to miss this.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Every second, 127 new devices connect to the internet. You can feel it happening, our digital world expanding with every breath. We're entering a whole new era of connectivity, and Mediacom will be ready to power it with one of the nation's first 10G platforms. We'll be bringing you more speed, more capacity, more security, and the power to do more than you ever dreamed possible.
Welcome back to Surviving Bad. I'm your host, Peter Komendowski, and we're talking about an alarming problem in Iowa. Child abuse and the effect the pandemic is having on people that may be increasing the number of children at risk. To better understand the nature of that risk, we've asked Lisa to talk a little bit about what these adverse childhood experiences are.
Yeah. Yes, thank you. So the original ACE study, when we say the term ACEs, it's typically related to 10 of what we call the conventional ACEs of trauma internal to the home. It includes sexual, physical, and emotional abuse, emotional or physical neglect, and then what we call household stressors. So a parent with a substance use issue, a mental illness, divorce or separation of parents, as well as incarceration of a parent. So that was what traditionally we considered as ACEs. Really, as the research has moved forward over the last 20 years, we are very clear that that's not the only trauma that kids experience and that families experience. It is things like natural disasters, like we've had in Iowa this year, things like pandemics, things like medical trauma and racism, things like a parent passing away or a caregiver passing away. So when we look at those and that impact, what we can see, if left unsupported or unmitigated, we see children who then, as they move into adulthood, have a wide range of increased risk for social, behavioral, and negative health impacts and negative mental health impacts. So it's really important that we identify and try to prevent and mitigate that trauma now so that we don't see some of that long-term impact. When we look at ways to do that, We look at making sure kids have positive experiences, even when there's things going on we can't necessarily prevent. But we also want to make sure that we are building family resilience. Uh, a lot of us may think, and we've heard the term, kids are born resilient, but the science actually refutes that fact. Kids have, the science of resilience tells us that the people, the systems, and individuals' child's life really help build their capacity to get through negative situations. So as I said, we want to prevent as much as we can. Unfortunately, things like natural disasters, pandemics, other conditions, it's going to take a lot longer to prevent or mitigate those. And so what we want to do is make sure young people have all the resources and tools so that they can move through those negative challenges.
Well, that's an amazing thing, and it sounds like an amazing challenge. Now, Greg, your organization really gets involved in some of the intricacies of making this prevention stuff work.
Yeah, that resilience Lisa was talking about is so important too, for those kids not only being able to have and mitigate the impacts of whatever those traumas might be. We know that trauma is very personal and could be anything. You know, we all respond to things differently based on that life experience, but it's also really key in those children growing up to be successful, productive adults and members of their community later on in life. So we've really tried to focus on, it takes a whole community to support that family and to support that child having that successful development. We hear so much throughout our work of the school should be doing this, or the parents should be doing this, or DHS should be doing this. It's really that whole community's responsibility as adults to ensure the happiness and safety and development of those children. And we talk about that through the protective factors as we're working on building that community resilience. And those protective factors that can help with that are social supports, are parental coping skills, parental understanding of child development, concrete supports, food, housing, jobs, things like that, and then the social emotional competence and well-being of children. So there's a lot of different things communities can do and different community members can do to help support a family. It can be as easy as, I am a safe, supportive relationship for a child. Right? We know through this research that the existence of that one safe, supportive relationship for a child can mitigate the impacts of 4 or more ACEs, right? That high-risk group, just having that one safe, supportive relationship can mitigate the impacts of that. And we've seen that through the amazing work that Lisa's done, and there's been a lot of studies around that a child can experience these adverse childhood experiences, can experience other trauma, and have that one person that helps them build that resilience and helps support them through that to help mitigate the impacts of that. Businesses can do things like focus on family-friendly policies. Right now, with the pandemic, a lot of businesses are looking at, parents are wearing a lot of different hats. Not only do I have my job, but I am also now a full-time daycare, and I am also now a part-time teacher. I had one of my kids at home with me earlier today, right? And that's hard for parents to juggle, and employers looking at, how can I support my employees and their families? Communities looking at making those investments, whether it's in childcare or bringing education and prevention efforts to their communities. Neighbors can look out for one another and ask, how are you doing, right? And those are the types of things we talk about. Teaching kids that it's okay to ask for help is so important. Teaching kids to identify their feelings and appropriate coping mechanisms for how to dealing with them, and knowing that those feelings are okay. So it doesn't always mean I need to bring a professional in. I need to bring someone with a PhD in to help my family. There's little things all of us can do along the way to ensure that family's supported and that child has the best chance at a healthy and full development.
Well, we're going to take a break, but there's a couple of points that you really made that I think are important for us to address. I think this mathematics of, you get past 3 or 4 or 5 different adverse childhood experiences, and we've noticed that there's sort of a threshold there of more bad things potentially happening. But I'd also like to talk about, when we come back from the break, about that sort of the intimacy that surrounds a child's life that may create sort of an environment where action might have some stigma attached to it, and how you deal with that. So we'll We'll invite you to talk about that after the break. We hope you all join us after the break. You don't want to miss this.
While a lot is changing in our world, at Mediacom, our focus remains the same, making sure you have the fastest, most reliable connection possible. During this critical time, we know your needs are changing. You may be working or learning from home, relying on telemedicine, or finding new ways to keep everyone entertained. If you need more speed, call or go online, and Mediacom will double your speed immediately for as low as $10 more a month for 1 year. Today, more than ever, you need fast, reliable internet. At Mediacom, we want you to know you can count on us. Our fiber-powered 100% gigabit technology network was built for the future. We have enormous capacity and power, and 99.99% network reliability. So even though these are uncertain times, we're prepared, and you can be certain we'll keep your world connected.
Welcome back to Surviving Bad. We're talking with Greg and Lisa about strategies to combat child abuse and how they start in the home, where that sort of intimacy of a relationship gets threatened. And then the idea of stigmatizing these problems may make a parent fearful about addressing issues that may be important to their children. Greg, would you like to address that issue for us?
Yeah, thank you. And I think Lisa touched on this a little bit before with this idea that children are born resilient, and that permeates and tends to permeate throughout life, to where we as adults don't feel comfortable talking to people about our problems, talking to people about our feelings. And kids see that growing up, right? And sometimes they're directly taught that. No, we keep that to ourselves. We don't share those things. And that's why that importance of helping children and helping kids understand, and we do work helping adults understand as well, that importance of understanding our feelings, understanding that having feelings okay, everybody has problems, and that it's okay to reach out and ask for help to solve those problems, right? We think that a lot of times asking for help is a sign of weakness. And in a lot of our trainings, we'll talk about that, and we'll say, who likes asking for help? And almost no one raises their hand, right? And they'll all say, I feel like it's a sign of weakness. I'm worried I'll be judged. And say, who likes helping others? And almost everybody raises their hand, right? It takes a lot of strength to ask for help. And that's a thing that we really need to be making sure that we're teaching kids, not only saying, yeah, it's okay to ask for help, ask me, right? But also showing them, look, I am also asking for help. Because what happens if we don't do that a lot of times is those problems just keep getting bigger and bigger, and we're either ignoring them or not addressing them. And now someone has to come in and intervene. Whereas I could have reached out to somebody in my community, I could have reached out to a friend, a parent, and said, hey, I'm struggling with this. Can you help me? I'm just kind of having a rough day, right? I just need somebody to talk. And that's hard right now during the pandemic, right? Because our normal interactions, the frequencies with which we may have been seeing people is not as high as it used to be. And we have to go different routes, and we have to put a little bit more effort maybe into reaching out. But that's so important for us to teach our kids that. And I know there's a lot of really exciting work in the community around social emotional learning and around teaching kids. There's some exciting things happening here in Iowa, really focusing on helping kids to learn that, and helping parents to understand that not only is it okay, but it's very valuable to be teaching those skills to children.
Now, Lisa, what are you seeing in terms of this dialogue with children? Because I'll tell you, as a parent with grown children, this is unimaginable dialogue.
Yeah.
We didn't go to this place when we were growing up. What are we doing better now?
Yeah. And, I often say that, when you become a parent, through whatever means you become a parent or caregiver, it's not like you get a handbook that tells you turn to page 10 when your kid's having a tantrum in the grocery store, turn to page 25 when you're trying to help your teenager make good decisions. We don't get that kind of handbook, but there are a lot of supports out there. And I think there's all areas, no matter how strong or maybe challenged you feel as a parent, that we can do. When we are looking right now to kind of build upon what what Greg said. I think there's importance of that family readiness, but also that community being ready to wrap around families. Even though we have that social isolation right now and may not be able to see others as much, it's important that as communities, we support families through those difficult times. So when we're having the conversations in our home about big feelings, managing emotions, stressors that are going on in the household, we also need our community to be supporting families as well. And so that's things like our faith communities, even if you're not meeting in person right now, reaching out to families and saying, hey, are you okay? Is there a way we can support you? We see a lot of community partners stepping up to make sure families have access to food. And so trying to wrap around that family and support them in managing those conversations in the home. Because even as we prepare parents to do this, parents and families are sitting in a community, in larger systems and structures. And we have to make sure those are allowing our parents to be the very best parents that they can be.
Now, when we look at a child in a normal life and then the pandemic happens, is there sort of a lurking, do these kids are resilient, they're living, they have a lot of contacts. Now, when we shut those off, is there a chance that some old negative energies come into play again? Some of those early experiences that they've been able to be more resilient in a normal world is tougher for them to deal with in isolation?
Mm-hmm. It certainly can. I think, we have a lot of conversations about whether things are open or closed and do kids have access to resources. We really have to think about regardless of whether a given service or support, whether schools are open or closed or remote, are the same supports still in existence? Because we are living in a pandemic. Prior to the previous century, we're living in a pandemic where we have access to technology. And so kids can still get access to mental health supports. Families still can get access to substance use services. We can find unique and creative ways to support families, make sure they have the supports they need. But we have to have the will to do that. And so, absolutely, these things can creep up and be reminders or re-traumatize based off of the current conditions. And that's where our responsibility comes in, not only as parents, but as communities, as Greg said, businesses, as our state as a whole, to make sure we're not allowing that to happen, because we are actively making sure, like I said before, wrapping around the family, even in this case of a pandemic and in many cases social isolation.
Well, those are great points, and I'd like to take a chance, if you're willing, to have you share some advice with our viewers after a short break. Stay tuned, you don't want to miss this.
I don't know how we would have survived without Mediacom. We have 5 kids, my wife and I, and we have Mediacom for all of our internet and all of our cable services. So I'm stuck in my house, but at the same time, I'm connected to people all over the world, and it's been fantastic.
Thanks to Mediacom, I've had reliable internet to continue to work business as usual, that I can continue to provide for myself and my family.
Right now, we all feel like the world is in a standstill. The internet has played a huge role in allowing us to stay connected to our jobs and the kids' schooling online and finding fun and creative ways to stay connected with the ones that we love. We couldn't do it without Mediacom.
Today on Surviving Bad, we're taking a moment to talk about finding hope and inspiration in the face of a particularly tragic problem, child abuse. Let's hear some advice our guests have to offer, advice that may really help, if not save, a child's life. Lisa?
Yeah, so I think one of the first things that we can do as parents and as individuals is make sure we're taking care of ourselves. It's very difficult to take care of children if we're not taking care of ourselves, and recognizing what our own needs are and asking for help. I also think in the community, making sure we're fostering those supports, and like I said earlier, wrapping around the family. So whether it's through your church, whether it's through your local shelter, whether it's through your local food pantry, step in and do what you can to support families. Talk to a neighbor. And then the last thing I would say is make sure you're using your voice to advocate for better conditions in your communities, in our systems for families. Allowing that allows our families to thrive. And so looking at those supports that families need, and let's make sure they have them, so parents have the opportunity to do their number one job of making sure they're supporting and helping their kids develop in a healthy, thriving way.
And Greg.
Want to come back to the point that it takes, and Lisa said this, it takes all of our communities to ensure those safe and happy childhoods for children. And we can make that difference in the life of a child, that even if they experience trauma, even if they experience ACEs, that one safe, supportive relationship can have a huge impact on that child having positive outcomes later on in life. So if I could ask people to do one thing, it would be try to be that safe, supportive relationship for a child. Reach out to your neighbors. As Lisa said, we need to take care of ourselves. It's hard to do that just on our own. So be that support for other people in your communities, and for communities to really come together and wrap around and say, what resources does our community need so that our families are supported? The last thing I would say there is, if you do suspect that something is going on, if you are concerned, ask a family if they need help. If you're worried about the safety of a child, the other thing that you can do is you can always call DHS. You can call their hotline and talk to them about what's going on, and try to make sure that that family's getting the resources that they need and that they have the support that they need.
Those are great points, and really the idea of that caring and loving a community is so important. We appreciate you sharing this with us today. And thank you all for joining us today. You can go to our website, healthyiowa.org, for more information. And keep your eye on Mediacom MC22 for our next episode of Surviving Bad, where we explore Iowa stories of survival, hope, and inspiration. On Mediacom MC22, your local programming leader.